Down syndrome, also known as trisomy 21, is a genetic condition caused by the presence of an extra copy of chromosome 21. This additional genetic material affects development and results in physical and intellectual differences. It is one of the most common chromosomal disorders and varies in severity among individuals. Causes: humans typically have 46 chromosomes, arranged in 23 pairs. People with Down syndrome have an extra full or partial copy of chromosome 21. The three types of Down syndrome are: trisomy 21, around 95% of cases, where every cell in the body has 3 copies of chromosome 21 instead of 2. Mosaic Down syndrome, the rare form, 1 to 2% of cases where only some cells have an extra chromosome 21, leading to milder features. Translocation Down syndrome, in about 3 to 4% of cases, part of chromosome 21 attaches to another chromosome. The cause of this chromosomal anomaly is usually a random event during the formation of eggs or sperm, though it becomes more likely with maternal age. Symptoms and characteristics: individuals with Down syndrome often exhibit a variety of physical traits, intellectual disabilities, and health complications. However, these can vary widely from person to person. Physical features: flattened facial profile and nose bridge, almond-shaped eyes that slant upwards, small ears, short neck, broad hands with a single crease across the palms, median crease, short stature, low muscle tone, hypotonia in infancy, the protruding tongue that may stick out. Developmental and intellectual characteristics: mild to moderate intellectual disability, delays in speech, cognition, and motor skills. Developmental delays: children may meet developmental milestones, like walking and speaking, later than other children. Learning challenges: while individuals with Down syndrome may learn more slowly, many can achieve a degree of independence and lead fulfilling lives with proper support. Health issues: congenital heart defects. About 40 to 60% of babies with Down syndrome have heart defects, which may require surgery. Hearing and vision problems: increased risk of hearing loss, frequent ear infections, and vision issues like cataracts or farsightedness. Gastrointestinal problems: issues such as blockages in the intestines, intestinal atresia, gastroesophageal reflux, or celiac disease. Thyroid dysfunction: hypothyroidism is common. Sleep apnea, due to structural differences in the airways. Leukemia: increased risk of certain types of blood cancers, though still rare. Alzheimer's disease: higher risk of developing Alzheimer's at a younger age from about 40 years. Diagnosis: Down syndrome can be diagnosed during pregnancy or after birth. Prenatal screening: first trimester screening, the blood test and ultrasound can measure the likelihood of Down syndrome. Non-invasive prenatal testing: NIPT, a blood test that analyzes fetal DNA in the mother's bloodstream, providing a more accurate risk assessment. Amniocentesis or chorionic villus sampling, CVS, diagnostic tests that analyze the baby's chromosomes for confirmation. Postnatal diagnosis: physical examination. Certain physical characteristics can suggest Down syndrome. Chromosomal analysis: karyotype test, a blood test can confirm the diagnosis by checking the number and structure of chromosomes. Management and support: while there is no cure for Down syndrome, early interventions, medical care, and support can help individuals lead healthy, fulfilling lives. Management focuses on addressing medical conditions, promoting development, and providing educational support. Medical care: regular checkups to monitor heart, thyroid, hearing, vision, and developmental milestones. Surgical intervention for congenital heart defects, gastrointestinal issues, or other complications. Therapies: physical, occupational, and speech therapies to help with motor skills, communication, and self-care skills. Developmental and educational support: early intervention programs, tailored services for infants and toddlers to promote physical and cognitive development. Special education services, Children with Down syndrome often benefit from individualized education plans (IEPs) that accommodate their unique learning needs. Inclusion. Many children with Down syndrome thrive in inclusive environments, where they can learn alongside peers. Emotional and social support. Family support, counseling and support groups can help families adjust and navigate the challenges associated with raising a child with Down syndrome. Community resources. Programs that promote socialization, independence, and life skills for individuals with Down syndrome. Life expectancy and quality of life. Due to advancements in medical care, particularly for heart conditions, the life expectancy for individuals with Down syndrome has increased significantly, with many living into their 60s or beyond. While intellectual and developmental challenges are common, with appropriate support, individuals with Down syndrome can live meaningful lives, engage in work, and participate in their communities. Conclusion. Down syndrome is a genetic condition that presents a range of developmental and physical challenges, but with the right medical care, educational support, and community involvement, individuals with Down syndrome can lead happy, productive lives. Ongoing medical research and social advocacy continue to improve opportunities and outcomes for people with this condition.